Welcome everyone to today's program, which is brought to you by SpineMark. I am Robert Kurtz, moderator for the webinar. The program will begin with a presentation, and then we will have a question and answer session following completion of the presentation. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenters will attempt to answer as many of your questions as they can during the Q&A. If you have a question for a specific presenter, please indicate this with your question. It is now my pleasure to introduce our presenters. We have Marcy Rogers, President and CEO of SpineMark, the premier global spine service company for the development of spine centers of excellence and spine research organizations. SpineMark works with physicians, hospitals, facility companies, third-party payers, and medical manufacturers in the fields of spine, pain, orthopedic surgery, and neurosurgery. Next, we have Henry Huang. He's founder and CEO of California Healthcom Group. California Healthcom Group is a healthcare technology and services company that developed one of the world's first cloud-based digital hospital platforms, which connects patients in emerging markets to elite care providers around the world, providing patients in emerging markets access, answers, and solutions to their medical condition. In May 2013, the company launched the digital hospital platform in Asia, and has already signed on more than 1,000 care providers from US, China, Japan, Korea, and Taiwan. Finally, we have Michael Cambron, who is Director of Strategic and Business Development for Palmdale Regional Medical Center in California. In this position, his responsibilities include strategic and tactical planning, business development, and successful implementation of business and operational plans. Michael is also founder and managing partner of Transwest Biologics, Applied Medical Solutions, and Integrated Research Solutions. He previously held leadership positions at SpineMark, Century City Doctors Hospital, and Cedars-Sinai Medical Center. I will now turn the floor over to Marcy to begin the presentation.
Rob, thank you very, very much. Good morning, everyone, and thank you for joining our webinar. We've got a great forum for presentation today, so we'll just get started immediately because I think you'll really enjoy the information we have to share. Next slide, please, Rob. I wanted to kick off this presentation with what found me one Sunday morning as I opened the newspaper to see front page of the New York Times, a story that really resonates with us, and that being the Times exposing a piece on medical tourists and simple math, comparing the cost of procedures abroad, documenting how many Americans are traveling abroad for their care for hips, and the fact that this one particular patient, Michael Chopin, actually had a hip replacement in Belgium for $13,660 versus what the U.S. estimate would have been over $78,000. So the exodus has been in place for a while. And it was interesting to read about the nuances and what's happening with Americans going abroad. But equally as important is the fact that we, because of our reputation here in the United States as being a superior healthcare delivery system, we now, and have in the past, been a magnet for patients from abroad to come here for specialty and medical and non-operative care. So the time is now, and this article only validated why we need to be thinking about medical tourists as our sixth payer mix, if you will, and what we can do to attract those patients to our facilities for very preferable rates for service. Next slide, please, Rob. So how does the program all fit together? We're labeling these spine destination centers, and the program structure in many ways mirrors what we talk about when we set up a center of excellence. But we've had to add some extra components to support patients who come from outside the country. It's very important to have an infrastructure, a delivery system of operative, non-operative, and conservative care, because just like we know here in the States, 90% of the patients don't need surgery, they need non-operative type procedures. And to have the support of a team to be able to effectively take care of these patients. Next slide, Rob, please. how do you talk about differentiating yourself in the market to be able to attract medical tourists? Well, one way is by creating and making and branding yourself as having a spine destination center and developing some marketing and promotion activities that will lend themselves to reaching patients from outside our borders to come here. The other that we look at when we set these up is game-changing technology and what that does for patients coming here that they may not be able to experience abroad. Rob, next slide, please. So game-changing technology is a strong component of our spine destination centers. And in particular, we also like to look at minimally invasive technologies that allow patients to have a very, very successful result with minimal downtime. When we're thinking about game-changing technology, it comes to mind that Mazor Robotics has set the stage for actually creating new safety measures, error prevention, and clinical standards of care. So the program and having a silo for robotic surgery becomes a magnet not only for recruiting new surgeons to your facility and having them participate in the program, but also because of strong patient demand. Patients now are very well-informed consumers, and they want to go where they can experience the most state-of-the-art procedure experience coupled with strong support from ancillary modalities and the staff. The ROI, the return on investment for something like this, you might be worried that it's beyond your reach, has also been very successful in contributing contribution to margin for these cases for hospitals that are now hosting this in their sites. Next slide, please, Rob. As we all know, surgery, and as I mentioned earlier, is really only one component of spine care. Non-surgical accounts for 90% or more of the volumes and spine revenue. And under that modality, you have a variety of procedures from non-invasive treatments, physical therapy, occupational therapy, chiropractic, holistic, all under the conservative alternate medicine portal, if you will, injections, interventional pain for therapeutic as well as diagnostic purposes, and various other forms of restorative modalities for function. Next slide, please, Rob. What does the Spine Destination Center focus on? Well, you want the full continuum of care. Obviously, if patients are coming with significant spinal issues of instability and disc degeneration, and the more ablative and more aggressive procedures like 360 fusions and others are considered, there's some groundwork to be done in not only managing the longer stays of patients who have more complex or deformity procedures, but also to establish a relationship with local doctors where the family will ultimately and patient return to continue to monitor care. Minimally invasive surgery, simple fusions, non-fusion procedures are excellent for spine destination types of patients. Next slide, please, Rob. So what obstacles and opportunities, medical tourism, alliances, and partnerships, there's a lot of people out there marketing themselves as the ultimate partner or agency to be able to deliver medical tourists to your door. I would say, based on all of the marketing I've seen, I've narrowed it down for us to 5 or 6 strategic partners that we know can perform and deliver the types of patients that are not only suitable for our programs, but that we have a great chance of generating success. So there's many opportunities for you to connect with all of these agencies, The obstacles are to be able to do your due diligence and look to be able to quantify exactly what type of volume you can anticipate so that you can plan your infrastructure needs. Rob, next slide, please. It's going to be very, very important, and I say it for when we're approaching healthcare reform, when we're trying to build niche programs. It all has to also center around benchmarks, protocols, and quality metrics. That outcome data collection and being able to document your results with data is key in this environment, and also something that medical tourists will be very attracted by, because they know that not only have they heard it's the best place for care, but there's objective evidence to support that. Next slide, please, Rob. So outcomes are really driving a number of things in the climate of healthcare today, particularly in spine. Number one, suggesting a spirit of transparency, proof of accountability and performance, and very importantly, the ability to leverage or maximize reimbursement from third-party payers, as well as when you're looking at your cash, international cash rates for medical tourism patients. Next slide, please, Rob. Spine Destination Center goals. Well, I'm sure you're probably saying to yourself, how do we know what to expect? How can we develop a return on investment for the resources for this program based on the volume? And what kinds of steps need to be taken to be able to ensure that we can meet these objectives? So we like to look at a slow launch period over 6 to 12 months of trying to attract a smaller number of patients, maybe 5, 6 to 10, knowing that many of these patients may not need procedures per se. Sometimes they just need non-operative or consults. And ultimately, with success for the patients that visit your spine destination centers and the results that they've achieved, with the continued marketing and growth, a nice number to look towards over post 3 to 5 years is somewhere between 18 to 30% of your patient volume could be driven by medical tourism. Simultaneously, corporate self-insured employers are looking for opportunities to send patients to designated employees, to designated places in this country instead of sending them abroad for spine care. And it's a great opportunity, and one that is can also be an important part of your case mix, your payer mix, and we like to look towards building that up to 20 to 25% of your referrals. Next slide, please, Rob. That concludes my presentation, and I have the pleasure of now turning over the microphone, if you will, to Henry to talk to you about California Healthcom Group and their experiences and product.
Thank you, Marcy. I appreciate the fine introduction to SpineMark, and today I will be giving an introduction about California Healthcom Group's newly launched digital hospital, as we coined the name earlier this May. And so far, since May of this year, we've generated over 2,000 inquiries and over hundreds of consults that are paid to providers abroad in the U.S., Taiwan, Japan, and Korea, primarily from Chinese patients. And the reason that why we focused and developed our program to launch in China is, next slide, please. Oh, thank you. As you guys can see, this is a picture, an actual picture of a hospital in Beijing at 8 p.m., and that is the line that people every day have to go through in order to obtain access to care and physicians. China as a whole is short about 12 million medical staff. And it is very problematic for a country whose spending power has grown to the second largest in the world. And some of the data that we've gathered so far has indicated there is a great demand for obtaining healthcare services abroad, especially in the United States, because of something Marcy said earlier, that they still view us as superior for many reasons, not such as research and development. We do have the luxury here in the United States of a lot of government-supported grants, that enable and advances medical technologies and research. Next slide, please. And the market size today I wanted to address in China is that, of all the money that is being circulated in China, which last year alone served for more than 12 trillion US dollars invested in the private hands, and over 1.75 million families with more than 1 million US dollars as assets for investments, 60%, 67% is most likely to spend it on executive health care, according to the research. And that is very interesting. As you can see, it's greater than tourism, it's greater than education, especially for their kids. And Chinese, let me tell you, it's big. They're big on education. And this data indicates that health is really a big concern as the government faces a big problem addressing the aging population. And after 1979, the one-child policy took into effect. So the working population that was once massive now is shrinking toward one that is really kind of winding down, if you would. And now their aging population has diseases that are coming out. And from so far on our platform, the patients we've seen, the disease trends are getting younger and younger. Next slide, please. So this year, we introduced to the market the digital hospital, and the concept behind that digital hospital is asset-light healthcare delivery. Better quality, access, and save time and money. This program is really beneficial to doctors in the U.S. and healthcare providers here, and also beneficial to the patients because they end up getting what they care most about, which is treating their condition. And with the healthcare system in the U.S. going a certain direction, it may be very good for a lot of providers to tap into the medical tourism market that's booming right now. Next, please. So a little diagram of the platform, the digital hospital that we launched in China this year called Huang. And the digital hospital platform allows providers around the world to sign up and be ready to accept and interact with patients in China. Whether it's mobile devices on a computer or anywhere, patients now can go into our network and browse over thousands of providers in the United States, Japan, Taiwan, and Korea, and seek some of the best services, directly without any intermediaries necessary. And our system allows them to transmit their electronic medical records, allows them to pay the provider, which in turn guarantees the provider payment for the consultation and medical services acquired. And next slide, please. And how it works is the hospital, through the platform, will be able to directly interact via video chat with the patient. And we have a service arm that translates medical records and also do live translation, so that no matter what language is required, we are able to translate back to Chinese patient live, and ensuring that live interaction between the patient and the provider. The next slide, Rob, the next slide will be an example of what the patient will see when they come to our platform. So the patient will browse our platform based on disease, trend, or medical service needs. And for instance, if they selected orthopedics, they will be on our database. All the orthopedic surgeons or orthopedic specialists will show up, and then they can review each of their background and understand the services and credentials that they have. And we've done all this. We do all this credentialing and translation in our platform for the providers so that the Chinese population can understand. So the next slide please. The next slide is the bio, a bio of a doctor the patient would actually see on their end, and the price that the provider has dictated for a consult. And in it, as you can see, the patient can now really understand who it is they're seeing, what type of background, and if that is a good fit. And through our platform now, our providers here in the United States primarily have seen a growth of patients from consultations to people coming here to acquire medical services grow in the short time that we've been out. And it's very exciting. So that will conclude my presentation, and I will hand it off to Michael.
Thank you, Henry. Thank you, Marcy. I'd like to thank everybody for attending today. As many of you probably know, implementing these types of programs are very challenging, and I'd like to start with how we did it at Cedars-Sinai. And can you go to the next slide, please? So some of the things that we did very well at Cedars was that we increased our reimbursement across the board for everything. Now, how we did this was we did cash package rates. But getting that cash package rate out in a format that the patients were able to understand was very challenging for us. So our outreach efforts centered around using the consulate offices and the embassies initially with high-end patients that could afford these types of relocations to the United States for care. We didn't have the privilege of having Henry's platform at that time or Marcy's product line knowledge. So what we wound up doing to accommodate that was we went and started just throwing things against the wall and seeing what stuck. Not much did. So what we decided was the bundled billing works because then the patient has one bill. Because at first we started one fee for the doctors, one fee for this, and that was very aggravating for the patients. So we had to come to terms and meet with our doctors to get them to agree to a certain price structure. And we took a little haircut on what we thought we would make, but we still doubled our return in terms of the hospital for the procedures. We started off also to try and get top-minded presence in the market across the country internationally. So how did we do that? We knew that the U.S. military at that time was in the wars and everything for telemedicine, so we approached DARPA. There was a gentleman there named Ron Potich who was the head of the telemedicine program for the military. So how we can incorporate that to make it better for physicians in the field across the world to be able to communicate when they needed a referral for specialty care. And we found that to be one of the best avenues to ever pursue. Juan came in and he identified what we needed to set up the program, and what we really found that the physicians really became satisfied because now we had something of substance to share with them. It wasn't just we're throwing this, we got all this technology and everything, and the product itself looked good on paper, but in reality wasn't working very functionally well. So then we had to figure out how are we going to do all this translator services, because some of the issues that we had back then was in Los Angeles market, we'd have maybe 80, 90 different languages being spoken, and we only had translators for maybe 30 of those different languages, and they were only there Monday through Friday, 9 to 5, and if you happen to have a Hispanic patient, then you were lucky. But what we did and found that helped us a lot was we came up with this concept of going with MARTI, M-A-R-T-I, and that's a robotic system that's very similar to Henry's platform in the sense of this. You have a camera where you're able to see the patient and the doctor on the other end of the line, like teleneurology or telemedicine that you have today. But it also has the a translator built into it. So when you're speaking Mandarin, for example, a Chinese face appears on it and speaks Mandarin to the patient, so there's a comfort zone. The doctor speaks to the monitor then translates it and speaks it back to the patient at that time when they're on site at your organization. So those are all good things that worked well for us. Can I go to the next slide? But what we found, and what I'm trying to avoid here at Palmdale and UHS, because we're instituting this in Nevada, is how are we going to broaden our focus so we don't make the same mistakes we did in the past? And part of that's building programs like Marcy has through SpineMark, so we have the core competencies established. Secondarily is finding the platform like Henry has, and thirdly is putting the pieces in place inside our organization that you don't think about. And so one of the things that we should have been thinking we always thought we could do it better ourselves, right? Every one of us in these large organizations thinks, well, we got the technology, we've got the people, we've got all the assets, why do we need outside help? Well, it accelerates your profitability. I can tell you in year one, for our telemedicine program at Cedars, for example, we lost money. Year two, we lost money. We talked to Ron Poropodich at DARPA, got some guidance, got some structure, because the military wanted to partner with us on it, and we turned a profit that very next year. ABC Hospital in Mexico City came to us and said, how can we work with you? We had entities from all over the world coming to us asking, how do we get engaged because we need help in our own markets to be able to grow these types of services and programs. And then we had to find a way to be flexible with our staff. When people travel from around the country to meet you, they may be flying in on Friday, and you've got your nurses, your x-ray, your CT techs, your surgical staff all out. That coordination of care became a pivotal point, and that's why we use nurse practitioners as our patient navigators. And they were very effective because they could write the orders within the limitations of the medical staff at your respective organizations, and it accelerated things. And they could handle the nursing component, and they could speak the language. We also used the post-treatment care and follow-up. That was a failing on us, massive failing, because we didn't anticipate the non-compliance by the patients once they leave your system. So we had to start rethinking our model, and we went back and we talked to the community where they came from to build in the primary care follow-up, physical therapy follow-up, and whatever else the patient required at that time. You know, and we were slow to adapt. We didn't believe it. You know, honestly, we looked at this model and we said, oh, it can't be this good. You know, who's going to pay all this extra money? But believe it or not, in foreign countries, there is a mass market of people that have the means that will go anywhere to get the health care they deem as the best. And some of the things they looked for, most importantly, from the physician, were the physician names. Did they train at a U.S. medical school? Did they have fellowships? Did they have hospital appointments at major organizations? On the West Coast, for Asia, it's very important they have UCLA, UCSF, USC kind of affiliations. That was a draw. They'll still go other places, but if you have that, those got more hits, those doctors that have those connections. And the same thing could be said in the East Coast for people from the Middle East. If you had Cleveland Clinic, if you had Mayo, if you had Harvard, same thing. Those doctors got the majority of the hits. So when we were looking at it, we were saying, well, how can we do this without really offending? And, well, we messed up there too. We didn't think much about the transplants, and we had two transplant center affiliations with UCLA and Cedars, and we just started inviting people over, giving them the consults, workups, and listing them. And then we ran into trouble with UNOS. Same thing for OB, you know, and not a good thing if you're bringing a lot of foreign people into the country, and then all of a sudden they determine that, you know, it's an American citizen now. Are we helping people to become American citizens? So it's hard to explain your way out of that box. We didn't have our IT infrastructure, as you see there, in place. We didn't have enough bandwidth to manage all the flow of information that was coming in. We didn't ensure that the DICOM standards were the same in each country that they were working in, so a lot of times we'd have to bed exit and reschedule meetings. The EMRs don't talk. So we had lots of issues there in printing records, getting them sent over to make our doctors happy. And that's why you need people like Marcy and people like James, who have had a lot of experience in building these things. And then when you look at the executive health, which James touched on a little bit, it really is the driver. when we started going to Pepsi, we started going to Toyota, to Honda, for example, they started bringing the business to us. Now when I'm at Palmdale and Las Vegas, the cities in northern Los Angeles County, the county supervisors are supporting us in developing medical tourism. In Las Vegas, the mayor has actually hired a team over there to assist people to develop medical tourism for the city because they see the value in providing healthcare services to people from outside this country with means. Next slide. And with that, I'd just like to thank you, and I'm going to turn it back over to Marcy and Henry, and we'll be willing to take some questions here. Thank you.
Thank you, Mike. This is Rob. I'm going to take control of the floor for a moment. I want to thank you for your presentation. I want to certainly thank Marcy and Henry for their presentation as well. It's now time to begin the attendee Q&A portion of the program. As a reminder to our attendees, if you have a question, you can submit it by typing into your control panel in the space labeled Enter a Question for Staff and clicking Send. If you have any questions after the program, any feedback or requests for topics for future webinars, you can just respond to any of the emails you received about the program, ones after you registered or any that you received announcing the program. I have a number of questions to get to, and if we don't get to your question, don't worry. I'm going to make sure to share all of your questions with today's presenters. I'm sure they will follow up with you offline. Let's jump right into it. Mike, I'm going to direct this question to you to start, and we'll see you then if Marcy or Henry have any additional thoughts. How do patients select your organization over others? You started touching on that a bit, but maybe a little more on how and why patients select you.
Well, one of the key thing is the physician. Culturally, and Henry can speak to this as well, in the Asian market, they look for white American doctors. It's just a cultural thing, but they also look, like I said, at what their CV, where they were trained, what their preparation was. It's very brand loyal, so they recognize names like UCLA, USC, Harvard, Cleveland Clinic, Case Western, those types of places. In spine, they understand things like Texas Back Institute, for example. Then you start to look at what the financial considerations are, but that's a secondary consideration for most of these patients. They do care about it, they don't want to be taken advantage of, and they prefer to have a package deal arranged for them, so when they arrive, they have their hotel, their travel, translator services, their family taken care of for the entire period. So they just want to know what the cost is up front. Typically runs 2 to 3 times what is my experience in my markets of 150% of Medicare. So you'd be looking at 300 to as much as 500% of Medicare reimbursement, and in some cases even more, depending on what the service is that you're offering. And again, we're always asked, can you open one up in Vegas? Because people want the tourism part of it to be real for them as well. Being in a nice location is helpful, or adjacent. People like to go to San Diego, San Francisco, Chicago, Las Vegas, and those are considerations.
Excellent, thank you. Marcy, Henry, any additional thoughts?
I think Mike's covered what would be my response as well, in that, it's the credentials of the physician, it's the support services for the facility, and the background and the expertise. So I think that's key, as I see it, in attracting these patients.
Excellent. Well, we'll jump into the next question so you can get through a few more before we wrap up. I'm going to just put this out on the floor to anyone who wants to comment. Which countries make the best targets for medical tourism? Are Canada and Mexico more attainable markets for most hospitals rather than Asia? Also, should this be a strategy mostly for academic programs, or can it work for community hospitals as well? Marcy, you want to take the lead on that?
Well, I absolutely think all of those countries are candidates, and particularly Asia. I'd love for Henry to jump in here. I think this is a community hospital program, as well as it can be an academic center program. There are no boundaries there. In fact, I've actually seen community hospitals develop these very successfly in my work in craniofacial surgery. So, Henry, your thoughts?
Yes, absolutely, and I agree 100%. That's exactly what I was going to say. And in China, particularly in the market that I've developed, I think it's really a blend of both, academic as well. We have had physicians in China consult with doctors and care providers on our network, as we've experienced for other purposes, unpatient related. So, we've pretty much seen it all.
Excellent, thank you. Let's move on to another question. Henry, this one is directed toward you. We'll do a quick two-part question here. Is there a fee for providers to sign up, and can you talk about how you differentiate yourself from medical tourism facilitators?
Sure. Yes, absolutely. No, number one, there is no fee for the providers to sign up. I really view this platform that I've developed as like an eBay or Amazon of healthcare, and the reason is because the provider are the sales, are the people selling the services, and the patients are the buyers in this case. And I believe that my service offering for the providers to get on my network and provide service and open access to patients in China is very important, as in China right now, I think one of the main key differentiators that I have with a lot of medical tourism facilitators, is that we are the only ones that are allowed to really direct engagement from, between patient and doctor. So the patient can actually see the doctor live using our system with live translation. And I think that's really a key differentiator in terms of transparency, trust, because in the market like China or in other emerging economies, there's a lot of skepticism evolving around, the payers, the patients, because there are a lot of people that go around promising to connect them with the best, and it ends up not happening. And the patient are the ones that get harmed because they have a condition that sometimes may need to be treated right away. And by virtue of our, our network, what we allow them to do is we bring patients to the providers. We do 80% of the work, and they do what they do best. They take care of the patients, right? And we help the patients connect with the experts by bridging the cultural differences between the East and the West. So I would say that's our main differentiator.
Thank you, Henry. Let's get a few more questions, and I'm going to give our presenters an opportunity to share some final thoughts. I want to get to just a few more. It's an interesting question. My hospital is in a rural area. What's the chance that medical tourists would be attracted to our center? Marcy, you want to take the lead on that?
Yeah, Mike, jump in on this because, we have a classic example that we were with a hospital in a rural setting in Louisiana. And one of the strategies we looked at there, and Mike had helped us with that, was to attract patients from outside the area and state. So I think that rural hospitals are equally as suitable many times for patients, but there has to be an infrastructure in place to handle these patients and the support services they're going to need. Mike, your thoughts?
Yes, Marcy, I couldn't agree more with what you just stated. One of the things we do in the North Los Angeles market, Palmdale Regional is a high desert facility located about 45 miles north of Los Angeles. And what we're doing is we're getting a lot of attention and attraction from the Los Angeles market for some of their higher-end clients just in the LA market. We've gotten interest from medical directors for territories outside of the United States that want to bring all their patients from, for example, Guam to Palmdale. And there's a reason for that, two reasons, in fact. One's the privacy issue. It's out of the city. It's convenient. The other is a cost issue for those patients that do have a financial burden. Being in the rural area versus downtown LA is considerably less expensive. We do provide and insist upon providing a concierge atmosphere and service within the organization, to Marcy's point about being prepared to handle these. And going back, on your issues about Canada, Canada is an ideal market for rural markets because outside of their 3 or 4 major cities, it's a very rural community, and some of them are put off by large cities.
Thank you. Mike, I'm going to stick with you to start discussion on the next question. I think we'll probably get to one more after this. How do you handle instances where the services provided are illegal in the home country, such as abortion?
Well, this is best addressed when you look at it up front. We start with a bioethics committee within the hospital, and if we don't have one, we will seek outside bioethics committees from larger academic institutions. We then send it to a company in California, for example, because of its uniqueness in terms of healthcare law and reform. We send it to a local attorney here outside our organization, like a Hooper Lundy Bookman, for example, and then we get a fully informed consent, and we determine up front as an organization what services our organization is willing to do, where that might cross boundaries of morality or ethical in certain cultures and countries.
Excellent, thank you. Let's do one final question, and then again we're going to have the presenter share some final thoughts. It's going to be a two-part question again. What marketing techniques do you use to generate medical tourist referrals? And can you speak, Marcel, have you start this, can you speak a little bit about how an organization, in this case, very competitive environment in upstate New York, a lot of hospitals in the community, surrounding communities with spine service lines. How do you differentiate oneself to attract medical tourists? And again, I think this one maybe ties into just generating tourists in general as well.
That's a great question. Part of the marketing strategy when you begin the thoughts about creating a spine destination center is to not necessarily confine your marketing efforts to just agencies or look to have support you by supposedly creating a relationship to send you medical tourists. We believe you have to take a broad-based approach, and that broad-based approach should include identifying countries and perhaps agencies within those countries that may be open, the Minister of Health or others, to contracting with you to send patients, to look for international types of employers in your region and local area or state that you can identify that may have opportunities to send members of their team abroad to back here to the United States for care. You want to have very targeted marketing activities, webinars like we're doing today, promotional, educational activities with physicians and allied health and nursing speaking about the services. And those are just a few. I think the internet is a huge tool for us, and of course it's become the library for searches of all types, whether it's healthcare or other things. So we focus highly on that as well. Mike and Henry, your thoughts?
I definitely agree with you, Marcy, and I think one very key and one very important thing to mention is language barrier.
Right.
I think that a lot of these institutions that wish to participate sometimes lack an adequate database in the language of their target market. And then next comes the market activity in the local markets, because you need someone to expose this information to the local population. So it's really a two-step process, and then you need time to digest for the patients on the ground to really digest what it is they're seeing and understanding. The good part is if you have something like service we provide is translation for the providers, you're one step ahead of the game.
Yeah, that's a great point, Henry. I totally agree. Mike, your thoughts?
Yes, well, Marcy, you guys have hit on most of the best ways to attack that. I just don't have much to add to that at this time.
All right, and I think that it's important because, Mike, you've actually put together a program, and thank you for sharing all the highs and lows of it. I think that's very helpful for everyone that is on this webinar to understand that this isn't an easy task, and I was particularly appreciative of the pitfalls you identified. So thank you. Rob?
Absolutely. Well, Ken, I want to certainly thank Mike, Henry, and Marcy for the presentation and for all the great questions from attendees. And if we didn't get to your question, as I said earlier, we'll make sure to share them with our panelists. And again, feel free to submit any questions after the fact by responding to any emails you've received about the program. I want to give each of our panelists a chance to share some final thoughts. I'm going to start with Henry. And Henry, if you want to fold in an answer to a late question we received from an attendee in your final thoughts, what are the initial steps to join the network?
Well, I think the initial steps are pretty straightforward. Just get in contact with either me or Marcy, and we'll get them set up very quickly and be ready to engage in medical tourism and attract patients.
Excellent. Thank you. Mike, you want to share a few quick final thoughts?
Yes. I really think that to be successful in this, it really is important that you build out a proper business plan and a pro forma so that your expectations on your return on your investment are going to meet with your needs, and to engage with a group like Marcy's team or some other entity like Henry to find out what those needs are going to be. That way you're going to be safe and everything should work out. And I would also add one last quick thought. I did think of one other thing. I really believe in the merits of the social media because our Facebook and Twitter has been a big help and assistance to us.
Thank you, Mike. Marcy, your final thoughts, please.
I think medical tourism is here to stay, and I think that capitalizing on this opportunity is probably one of the most important endeavors a hospital or institution can investigate to see if it'll work for them. So I'm thrilled that we could host this webinar and share thoughts with you. I'm so passionate about these opportunities. I would tell you that Henry's company and SpineMark have entered into a partnership on spine, but Henry's looking for expanding those partnerships so that we can support both spine medical tourist referrals as well as the other specialty medical, operative, non-operative types of patients that flow through his system. So I think we're at the tipping point of this becoming a major focal point of hospitals with spine service lines and centers. And I thank everyone for their participation today, and my esteemed colleagues, Henry and Mike, for their views and input.
Yes, I certainly want to thank you guys again as well. I want to thank all the attendees for taking time to join us. And with that, this concludes today's program. I know we have people on from all over the world, so rather than wish you a wonderful afternoon, I'm going to wish everyone a wonderful rest of your day. And with that, this concludes the program. Thank you for joining us.
Thanks.